I started Coastal Cardiothoracic Surgical Associates in 1991. We're consultants to the Novant New Hanover Regional Medical Center Hospital, and we provide all cardiac surgical services here. Initially, we did both our coronary bypass grafting and valve surgery through traditional open sternotomy. Now, we do those same procedures, often off bypass or through minimally invasive incisions. We've added to our scope of surgery, including implantable left ventricular assist devices. We also do complex aortic and arch surgery, and we have an active ECMO program that is a portable heart-lung machine for people who have lung failure and/or heart and lung failure. So the program encompasses all adult cardiac surgery. There are two things that make our program special in this area and in the United States. One is the longevity of the group of heart surgeons, perfusionists, and physician's assistants who work and operate here. And secondly, our long-term use of multi-arterial bypass grafting.
What we mean by multi-arterial bypass is utilizing more than just a single mammary artery to repair the heart. Multi-arterial refers to either using both internal mammary arteries or typically a radial artery from the arm. Arteries are naturally designed to carry high pressure blood flow, so that makes them a much better substitute than veins for bypassing coronary arteries. But much more importantly, the data over the last 20 years has suggested the use of multi-arterial bypass over single arterial bypass has an enhanced survival benefit. So essentially, patients that have multi-arterial bypass are going to live longer. Unfortunately, in the United States, the adoption rate has been low, so it averages about 15% across the country. But here at Novant, New Hanover Regional Medical Center, if you have bypass with us, you have 85 to 90% chance of having a multi-arterial bypass. Arterial bypasses have been shown to be durable all the way out to 25 years, and that's the most important thing that we can offer patients.
One of the specific ways that our teams work together is called a heart team approach. We take patients who need some sort of coronary treatment, specifically to open a blocked artery, either by surgical bypass technique, angioplasty, which is done by a cardiologist, or in some cases medical therapy. We take our highest risk patients based on their STS score, and we discuss them as a team and determine from a multidisciplinary perspective what the best approach is to deliver better outcomes.
The Society of Thoracic Surgery risk score is a validated risk score that assesses everybody's risk for cardiac surgery, whether that be a valve surgery or an open heart surgery with bypasses or a mixed surgery where we're doing both coronaries and valves. The STS score has become an important part of our assessment in all of our patients. We now use it in 100% of our patients. We feel like it puts us on the same page with that patient where we all understand what their risk is based on that number.
Minimally invasive coronary bypass surgery is cardiovascular intervention done through a small incision without the assistance of the heart-lung machine on beating heart. The minimally invasive approach ensures faster recovery and return to normal activities. For example, sternotomy patient starts driving and being more active anywhere between 6 and 8 weeks postoperatively, and the minimally invasive approach could bring the patient to normal social activities within 7 to 10 days. In our region, we're one of the few programs offering minimally invasive coronary bypass surgery, and the only program that offers a multi-vessel minimally invasive surgery, with the end goal being multi-arterial bypass grafting in selected patients. Our goal at Coastal Thoracic Surgery Associates is to provide the full spectrum of cardiovascular care, and if a patient from our local community needs minimally invasive intervention, they don't have to travel to a different center, and they can stay locally in the Novant network.
The mission of Novant Heart and Vascular Institute in the coastal region is threefold. Number one, clinical excellence and quality above everything. Number two, unparalleled service excellence. And then number three, a level of innovation and technological adoption on par with academic medical institutions and leading institutes across the nation. We're very excited that Novant is investing $1.2 billion in this community to build a new 225-bed heart tower, which would include 12 cath and electrophysiology laboratories, 10 ORs, including 4 cardiovascular ORs and 6 vascular ORs, and 2 procedure rooms, and is going to be an opportunity for the CT surgeons, cardiologists to work together to build a legacy of heart care in this community.
Patients should feel very confident that if they have their heart surgery at Novant New Hanover Regional Medical Center, they're going to be treated by a dedicated heart team that is committed to providing the most contemporary evidence-based medicine and surgery in the region and the state.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.